Imagine that moment in medicine when you're starting to do major surgeries, but we still did not have anesthesia and we did not understand germ theory. This was a period where you're very likely to die during the surgery or after the surgery. And let me take you to one of London's most underappreciated museums. Most people walk by here and have no idea what is up in the attic here. And many people didn't even really know this existed for a while. It was an accident that this was discovered, that a wall was knocked down. And what was found? The old operating theater. Let me take you back back to the mid-1800s, and let's see what surgery was like. It was not a pleasant experience, my friends. So come with me and let me tell you a story. Yeah, so here we are in the old operating theater, and let me show you around. As you can see, of course, we have the surgical table in the center. Underneath is a box of wood shavings. We'll talk about that. And you can see there's a gallery that surrounds this. And this was because if you ended up on this surgical table, you were here at basically a teaching hospital. And this room would be full of various medical students. The furthest row away would be think of it this way, the first year students, second year, third year, fourth year type students. And to get down onto the surgical floor, you would have the surgeon, the assistants, and a group that we called the dressers. And the dressers would be people that would help to hold the patient down and also dress the wounds. Now you got to remember, this is a period before anesthesia and asepsis. They didn't really understand germ theory. And you can see that's why, we have a wood table here, which we would never do today, of course, because of infection control. And also they thought if things look kind of clean, they were clean. So if you clean the instruments and they look clean, they're clean. You can use them. They didn't really realize that there were things like bacteria, viruses, fungi, things like that would cause massive infection. Now, why did we have to come up a series of stairs? And the answer is, right up here, is because of the glass ceiling. This is an era before really good indoor lighting. So if you had a glass ceiling, this provided you a lot of light. And now today is a very sunny day. And you can see that you actually do get a really good view down here on the surgical table, and would have a good view of the patient that you're working on. And typically patients would be brought in here maybe about every 15 minutes for different types of surgeries. Now, what type of surgeries would they be doing here? We're not talking a lot of the surgeries we would do today. A lot of this would be things like limb removal. And why were so many limbs removed? Well, because complex limb fractures back then, they just didn't have the skill, especially if it was an open type fracture. They didn't have the skills to really deal with it and prevent infection. The other thing too is, often people got run over by horse carriages. Got to remember, the streets are full of horses and carts going by. There's a lot of industrial accidents at home. And you end up with very complex fractures. And, if you were wealthy enough, you did not end up in a place like this. The surgeon would try and treat you at home if you had the money, but most people didn't. And if you ended up the hospital that was attached onto here, you're looking at possibly waiting a couple days. So if you have an open fracture, they need kind of dress through that. They don't have antibiotics for you. Maybe try and wash it out a bit. The good chances is by the time you ended up on the surgical table, you had an ongoing infection in that limb and it had to come off. And it was quite an ordeal. Limbs could be taken off quite quickly with a skilled surgeon, and you do want a skilled surgeon to do this. As I said, there is no pain relief. Now, just look at the view you would get. You'd walk in. Let me turn this camera around. You get the view. So you would walk in as a patient, and these stands would be full of people staring at you. Now, this was the woman's operating theater. So if you're a woman, all these men are staring at you. some of the things they did, if it's not limb removal, they did remove sort of superficial tumors of breast, things like that, some surgeries. And you would be here, and they call it a surgical theater because it is a theater. You are the main attraction. I hate to put it that way. And here's sort of the look you would get. Lying here, you'd be looking up. Now, as you were lying here, before they start the incisions, the surgeon would have the assistants and the dressers hold you down. And we can see, here's the wood operating table, and there's a box of sawdust. And of course, why a box of sawdust? You got to remember that once you amputate and once you cut into the skin, there's going to be blood everywhere, and this helped to absorb some of the blood. We can also see some of the instruments that were used, and it kind of looks like you went to Home Depot to get some of these. We have the saws, we have the sounders, and a number of instruments, which I'll talk about probably in another video. And these, between surgeries, were largely just wiped clean. So how gruesome were these surgeries? Let me tell you a little story about that. And this has to do with someone who I think you've heard of, and his name is Charles Darwin. Now, most people think of Charles Darwin, they think of the beagle and the story of evolution. But Charles Darwin actually started off as a medical student up in Edinburgh, in Scotland. And he was never at this operating theater, but one similar to this up in Edinburgh. And as a student, he went to observe some of these surgeries without anesthesia, and he was completely horrified by it. He wrote letters home talking about how it traumatized him, and it was one of the probably the main factors that led him to give up a career in medicine and give up at that university and move on and become part of the clergy, and then from there he actually ended up on the Beagle. So sort of indirectly, the cruelty and the experience of the period operations really had an important place in the theory of evolution. Otherwise, Darwin may have stuck with medicine and would have never ended up on the Beagle, never ended up on the Galapagos Islands, and theory of evolution would have had to wait for Alfred Wallace, who also came with theory of evolution, but that's another story. So, operations. One of the stories that sticks in my mind that I've heard about this particular operating theater, this being the women's operating theater, was a written report of a woman who came in for surgery in this theater, and she would have entered from back here. The women's ward was back here in the hospital, and she came in, and I seem to recall that they were going to remove a superficial tumor of the breast, and she came in, remember there's no anesthetic, came in, entered the room, a room full of gentlemen, the surgeon, the dressers, was packed, and she curtsied, hopped onto the table. Surgery was performed without any anesthesia, and after it, she got off the table once they dressed the wound, and once again curtsied, and was led back to the ward of the hospital. Those were some tough people. But hey, I guess it was better the alternative. So the old operating theater. So these instruments were just wiped clean. They just basically wiped them on their aprons. And if they look clean, bring in the next patient. Let's go for it. So not surprising that there were so many cases where people had infections as a result of the surgery. And at the end of the day, when you're done, you would just take your apron and you would just hang it up, and maybe get some of the blood stains out if you could, but that's okay. It'll get dirty the next time, so let's not get too fussy, was the thought. So this is the old operating theater. It's really one of my favorite museums in London, and come on out and support them. And you can see the glass ceiling up there.